concerned about the fact that it appears that the run-up to an election is making it difficult to obtain materials, documents and answers to questions that we are asking. We do not wish to be in a position at the end of the day when we issue a report that we're going to be told, oh well, you didn't have all the information. So the answer to that is we're not being given all the information. So we're very concerned about that, and I would just, on behalf of the Commission, issue an urgent request to those who know, please to provide materials so that the public may know what it is we're basing our opinions on. So that's, I'm sorry to say, just an observation. The second observation is, I didn't at the beginning make it obvious, but it probably is, that as Commissioners we do have reports and statements from all witnesses, including this one, some of which obviously we won't be able to hear, and we will just read. But my main question relates to paragraph number 11 in your statement. I'm going to read just a sentence in case others haven't got it, although these all will be made available. And this is how you put it. We are trying to implement major changes on a system that is currently broken and on organisations which in many cases have gone through repeated management change and which suffer from high staff turnover and low staff morale. So the question is this, relates to that part of the observation about a system that is currently broken. Now, I think one of the observations put in the opening was doing nothing is not an option. So really, what is, if the system is broken for whatever reason in the past, how is it going to be mended? Is it yet more consultation as you've suggested, or is there something beyond the consultation which you see should be the objective here?
Absolutely right. I would just say I do see that paragraph 5 praising the job that the staff are doing. I want to put that on record because I make no criticism of the nursing and other clinical staff who are coping, I think, with an extraordinarily difficult situation. To answer your question, there is agreement, I think, between all parties that a number of the proposals within that are in Shaping Healthy Future or which are implied by that are sound principles. Integration of health and social care, the ability to try and end terrible childhood bed blocking, the ability to try and triage better so that people go to the appropriate type of emergency service in that way. And a lot of good work is done on that. The difficulty is that the way that Shaping Healthy Future is being implemented, it militates against that in many aspects. For example, the loss of the majority of inpatient beds at Charing Cross is clearly not going to help the situation with A&E services. Because a large part of the problems with A&E are people who have to be admitted, but there are beds that are not available to go into. Equally, some firefighting increases in GP services are not going to provide the alternative insofar as it's applicable in primary care services. So I think there are two things happening with Shaping Healthy Future. Firstly, insofar as it's right, it's not doing what it says it should do, but also, the elephant in the room really is, its basic premise, which is that you can have this huge reduction in A&E services, and this huge centralisation of A&E services is not in any way programmed, and therefore that's what we have to look at again. And what we're going to come up with, I think, at the end of that, is yes, an increase in community services, yes, an integration of health and social care, and yes, hopefully, a better integration of primary and hospital services, but still maintaining a sufficiency, both in terms geographically and in terms of capacity of A&E services.
While they're thinking, I have another one, Frank. So it relates to triage in a sense. If I'm a member of the public and I have an urgent situation in the middle of the night, this is related to urgent care centres is there some kind of standard criteria? What is an urgent care centre? How do I know where I've got to go? And who's going to be there? And what are the criteria? It seems very fluid.
It's a huge, and I get some anecdotal stories about road signs and notice of consultation process. It is a huge problem. People get to know, even there have been significant changes before. For example, paediatric emergency care was moved from Hammersmith Hospital to St Mary's about 15 years ago. I still find people who are just getting used to that as a change. Changes of that kind take a long time to bed in. The terms in art, or sometimes the terms in public relations that are used by the health service body, don't mean anything to people, which is why people at the moment do not know where to go, and therefore they will, to a large extent, continue to go where they've always gone. So people who have serious, whether they're chronic or acute conditions, will still walk into the urgent care centre at Hammersmith. And I worry about the level of care that people will receive as a consequence of that. And that's not to be rude to people who are urgent care centres, but they do not have the same resources, the same degree of qualification as those who are available in A&E departments. And I think that the bottom line is that people are going to get a second-class service, particularly for people, particularly people who are less mobile, because they will not think, right, what I need to do now is get a taxi or get on a bus or come on buses and go to St Mary's, because then I will get the full range of treatment. I'm just going to go to Hammersmith Hospital as I've always done and see what happens.